talk to your kid. Don't sit down at the dining room table and say, now we're going to have a talk.
Youth that do gamble are 6 times more likely to develop an addiction as an adult.
You have this certain mentality, never my kid.
They shouldn't feel isolated for making a healthy choice.
For a safe, healthy, and drug-free community.
Watch Step Up to Save Our Children today.
Hello, and welcome to this episode of Step Up to Save Our Children. If you're new to our podcast, my name is Denise Mayer, and I'm the founder and director of Step Up Anderson Township. We are a coalition promoting a safe, healthy, and drug-free community. We are attempting to educate parents and caregivers on high-potency marijuana, fentanyl poisoning, underage drinking, and other drug and mental health issues. In this podcast, we are attempting to meet parents where they are, educate them, so that they're better equipped to talk to their own children about some of these really important and critical topics. So today, our guest is Dr. David Baum, and we are very excited to have him. He holds dual licensure as a clinical psychologist and licensed independent chemical dependency counselor. And he is with the Adolescent Substance Abuse Program in Cincinnati. He is the director, and I'm so appreciative to have you on, David. But let me tell you a little more about David. So he is the proud graduate of the University of Michigan. That's okay, Ohio State people. And received his doctorate in clinical psychology from Xavier University. Dr. Baum has been trained to provide general psychological services while specializing in substance use, trauma-related, and mood disorders. Dr. Baum works from an integrative perspective while employing evidence-based practice in all his clinical work. In addition to his work at ASAP, Dr. Baum also serves as the program manager of the Dayton VA MC Mental Health Clinic, as well as on the multidisciplinary dialectical behavior program team. Dr. Baum is also a certified provider of cognitive progressing therapy and evidence-based practice for helping clients with post-traumatic stress disorder, as well as motivational interviewing and motivational enhancement therapy. Dr. Baum has training in a number of other evidence-based treatments, and I'm sure we will be talking about some of those, right? Welcome, David. Welcome to our program.
Thank you. That was a great read. That was very impressive. That's a mouthful.
It was a bit of a mouthful, I know. And I thought, I know I'm going to trip over about 10 of these things, but I'm just going to do my best. So
yeah.
Yeah. Well, I know that you are a very, very busy man, and I can't even imagine how anybody could keep up with you and your children and your wife and everything. So yeah, wild times, that's for sure. Yeah. But I want to talk a little bit, and I'm going to turn it mostly over to you because I just want to pick your brain a little bit about the teens out there now. We live out in Anderson, and we live in a not my child kind of atmosphere until it is their child. And, unfortunately, that's where we begin. And I have known teens who have gotten in trouble with one thing or another, and reentry back into their typical life is very difficult. So I just want to cover some of those things with you. And there you go. So it's all you.
Yeah. So, obviously, in terms of the work that I do, I work with people across the age spectrum. But here at ASAP, we're focused on teens 12 to 19. And I think what you're saying really resonates. We have, the truth is that things have changed dramatically over the last, 10 or 15 years of doing this type of work. And, and they continue to rapidly shift and change because the landscape out there is changing. And kids are coming up just in a very different time now than even kids that were coming up in, 2010, 2015, a very different landscape. And so, their issues are different, but changing and shifting all the time. But the work that we do here at ASAP, we're focused on mental health and substance use problems for kids in that 12 to 19 range, and really healing families is our primary focus because anybody who knows someone who's had a child or a teenager or an adult within their family struggling with these kind of issues knows how much it can be a disruptor to the entire family and can really make things difficult for everyone in a family unit.
Absolutely. I've seen, marriages break up and all kinds of things when they're trying to deal with a child that has become addicted, to one
Right.
thing or the other. What are you
Yeah.
seeing mostly in that age group
Yeah.
for substances?
Yeah. So it's kind of interesting that, as I was saying, like things are ever shifting. What's kind of interesting, a couple of years ago, we were seeing a tremendous amount of nicotine dependence with kids using vapes, really, honestly, ubiquitously within high school settings. There were so many kids that were using nicotine devices, and then of course, like those would become a bridge basically to other kind of abusable substances. We can talk more about that later, but interestingly, the data kind of there's a couple of really great kind of large scale data sets that they give us information about the shifting patterns that I'm referring to.
Mm-hmm.
And interestingly, some of those things are actually starting to decline, which is wonderful news, both with teen drinking, teen binge drinking, and also nicotine use. Concerningly, we're seeing kind of a flip. So now, since the legalization of cannabis, here in Ohio, but more broadly nationwide, what we're seeing is much more problematic use among teenagers, as well as ability to acquire. But perhaps in my opinion, one of the more concerning things is actually the shifting attitudes of the kids, but also their parents around actual dangers of the substances that kids are trialing and using. And so to me, that's one of the most important factors, I think, as you think about this as an issue is, how have we changed culturally, both for the kids, but then also for the parents and for the way parents approach these issues, which I think is kind of to the point of, or one of the reasons why you wanted to have me on is because I can really speak to that specific change and having done this for a number of years, how things have kind of moved as our zeitgeist and culture has kind of shifted around cannabis legalization and such.
Right. Would you say, this has been my experience from talking to so many people,
Yeah.
is the perception of harm for the cannabis it is so low that, and people think, particularly if they watch old movies and if they're old enough to remember, Woodstock and all that
Right.
kind of thing, that it's just a little, I don't want to say a rite of passage, but sometimes they think of it that way.
Right.
That, it's a little joint. I smoked a little bit when I was in college. These kids will be fine.
Exactly.
But that's not what they're dealing with.
Right. That's exactly right. There's a number of different kind of tangents I could go on this. You're absolutely right about that. First of all, it is 1000% true that the cannabis that's being used today is nothing like the cannabis that was used. You mentioned Woodstock and, summer of '69, but even more recently, like the cannabis that was being used around the turn of the millennium is quite different than what's being used now. It's all grown hydroponically. It has been genetically modified to be maximally intoxicating. And so, so it's nothing alike. It's a very different kind of substance. So much so that we see other kind of medical complications from kids using it routinely. One of the least known but most impactful is cannabis hyperemesis, which is I don't know if you're familiar, but we get many kids that are having, vomiting and stomach disruption, inability to eat. And it's not, it has nothing to do with anything medically except for the amount of cannabis they're consuming and the potency and the toxicity of the cannabis that they're consuming. So yes, you're absolutely right. When it comes to potency and when it comes to, this isn't your grandfather's cannabis, that is the absolute truth. A couple of other things that have changed. You're absolutely right also about perception of harm. So that's one of the most important findings over the last, let's say 10 years or so is you're absolutely right. The perception of harm with the substance, cannabis specifically, has gone dramatically down while the amount of use and kind of the potency of the substance itself is kind of inversely related. And so what we're seeing is kids are maybe not using more, but they're using it in a fashion that is much more impactful into their lives, while their attitudes and their parents' attitudes around whether or not it's actually going to do them harm is inversely related. And so that creates a pretty concerning mix as we're trying to help kids, get to adulthood. There's one other thought that I had on this, just to close this up, and that is that adolescents specifically, when it comes to cannabis, are at more risk for developing addictive problems when they initiate substance use during these teen years. So it can be true for many people, and not to overblow the nature of this issue, but there are a lot of kids who, it is a normative rite of passage for kids to trial alcohol and try smoking cannabis and maybe using nicotine products. And the vast majority of those kids that try those products are not going to develop addictive disorders. The problem is for that, 10 to 15% that do, the earlier you try it and the more potent the substances are that you try, the more likely you are to have lifelong addiction problems. And so while we have that kind of inverse relationship happening, the worrisome thing for professionals like myself is these are kids that desperately need to get help immediately rather than waiting, because the effects of cannabis on teenagers specifically far outweighs the effects on adults. So a 25-year-old who is using cannabis even, a couple of times a week, or, the impact on their brain functioning and their prefrontal cortex, decision-making, judgment, reason, all those things that we want our young adults to flourish with, those are all the areas that are going to be impacted for a kid that uses habitually during their teenage years. And so for people like me, that is why I'm so passionate about trying to intervene at that point so they never get there to that point where their life becomes impacted long-term.
Well, and there's so many, and I know you'll get into these, so many other mental aspects of them doing this, and we can get into that in a minute.
Right.
But I was meeting with one of the head nurse out here at the local hospital, and she was addressing that hyperemesis syndrome.
Okay. Yeah.
And, how bad it is, and the kids are coming in, greening out, as they say, and vomiting and all that. But the parents think they have the flu, have a stomach flu.
Right. Yep.
And it's so difficult for even these professional medical people to get through to the parents that that's what's going on. Yeah. They don't want to think that.
And the only thing that resolves it is stopping using cannabis. So there's no other way to do it except for eliminating the substance itself. And then once you do that, all the symptoms remit and the kids are fine. But you're absolutely right. They think it's all kinds of stuff: stomach flu, anxiety. Yeah, absolutely.
Well, and the kids have, so baffled them. I mean, they don't, oh no, I did this, somebody else was sick. And, but the funny part is when they come back 2 and 3 and 4 times, you would think somebody would start thinking maybe this is not the stomach flu. So you're so right about that.
Hospitals are also not always, for better or worse. Right. Substance use disorders are not always top of mind for adolescent medicine. Yeah. And frankly, honestly, for many mental health professions as well, as we often think of substance use disorders as kind of secondary, but oftentimes they are the driver. They are the thing that is causing the mental health problems. And so they're not always thought of right away, but the truth is that, again, a lot of those issues can resolve themselves once you treat the actual underlying issues. Sure.
Well, I do know that in the summer, she said, it gets crazier and crazier because we live near Riverbend, where there's a lot of concerts going on and whatever. And it also draws people here. So you not necessarily have just our own community, but others too. And it is just unbelievable. Yeah. I just wonder, I do know this for a fact, but I'd like for you to mention it. The other things with doing the cannabis, because you already mentioned a little bit about they're using it differently.
Yes.
And so if you could just really maybe
100%.
Talk about that for a minute.
Well, and this actually kind of plays to your other point that you were mentioning before, just how things are different. So, you talked about kids that are able to really like snow their parents and finesse their parents and
Yeah.
tell them what they want to hear,
Mhm.
and kind of scoot by. You see a lot of kids that do that. It's not uncommon.
Right.
Part of the reason why they can do that now is because they're using cannabis differently than it was used 15, 20 years ago. So
Mhm.
15, 20 years ago, if you lit up a joint, everybody around you knew. It obviously is very pungent. Its odor is very obvious, and
Mhm.
if you know what it smells like, it's pretty obvious what's happening. Now, there's so much cannabis that's consumed, by edibles that are either imported or bought from, dispensaries here locally, and then kids, obtain them and then divert them and distribute them amongst their friends or whatever, or have an older sibling that's able to purchase it legally and then pass it off to them, and then it goes that direction. But so like there's that, but then there's also most of the cannabis that kids are using nowadays is vaporized.
Yeah.
It's in what they call carts. So and while a trained nose can smell a cart, they are less distinguishable for sure than combustible cannabis. That's unmistakable. The smell of burning cannabis. But the carts they're a little more discreet. So kids can use them in their room. They can use them in their bathroom. They use them late at night when parents aren't up. They have little contraptions that they can blow the vapor and the smoke into that masks the smell. I mean, they're pretty crafty. So it's much more. They can use in a way that is much more discreet nowadays than they ever could before. And so that's also opened up the possibility of using in school, in church, with friends, in public places. You mentioned at Riverbend, like that's a common place where either kids get overly intoxicated on alcohol, obviously, but many people are using cannabis products there. Now it's legal, so there's not kind of the guardrails around it that there were previously, for better or for worse. I mean, legalization is a whole nother kind of topic, but there are consequences. There are differences now because we've kind of gone through, we've kind of jumped over that fence. So now we are dealing with some ramifications for that political decision, for better or for worse.
And on those cartridges that you're talking about, is that a dab in there, kind of a?
So dabs are a little bit different. Dabs are they're butane hash oil, which is like used differently than a cart. A cart is like when you go to the gas station and you see like a nicotine vape. They're kind of similar to that, although they look like pens. They're kind of long. They're generally long and skinny, is how you know that. And they have you can actually see there's usually like a little golden kind of oil that's in there. Dabs are actually like they're what's called butane hash oil, and they're used a little bit differently, but they are kind of related in terms of their potency, which is I think to the point they are highly potent. So, whereas cannabis from when I was in high school, let's say many years ago, that cannabis was somewhere between probably 5 and 8% THC. Back in the 60s, 70s, you're talking like 2 to 3%. Like the kids nowadays wouldn't even get high off the stuff that people were using back then. These, dabs can go anywhere from 70 to 95% pure THC. Carts, same thing. I mean, they are so concentrated that the intoxication you get from them is nothing like what these kids' parents are, at least used to when they were younger. I mean, many of these kids' parents also consume cannabis themselves, and so that also kind of complicates the picture as well, because that also makes it a little more tricky to say, hey, you really shouldn't be doing this, even though I'm doing this. And and again, just to underscore that for kids, the consequences are just so much more severe with cannabis specifically than they are for adults. So it does create this kind of challenging kind of dynamic there. And parents often don't know. They just don't realize that most kids are not going to develop lifelong problems with drugs and alcohol. But for that 15% that do, if they're doing it at this age, there's some real serious high risk there.
Well, it's kind of almost like the parents are gambling, well, maybe my kid, okay, they might, maybe they won't be in that 15%, though, or 20%. They're going to be okay with this.
Absolutely.
And you cannot, as a parent, even as a professional, know for sure how
That's
a
exactly
child's
right.
gonna,
Yep.
do with that. And I
Yeah.
think it's really sad, and you touched on this, that I know parents who are doing this themselves.
Right.
Now, for the most part, some are doing the gummies, some are doing, I don't know about the cartridges they might be, but they're smoking joints or
Hmm.
whatever,
Yeah.
and we all know what that smells like anywhere you go. If I think we have had an influx of a huge amount of skunks in our general area, but really that's what it is. I mean, it's everywhere. And you can
Yeah.
think, oh my gosh, oh my gosh. Yeah. And I know that's how they used to complain in New York, and now we're complaining here. But,
Right.
you
Yeah.
know, parents are, as I have understood, the number one influencers for their kids.
Yes.
And when they know that they're doing that or smell it on their clothes and then try to say to the child, this is not a good idea for you. I mean,
Right.
what a message.
Tough hill to stand on. Yeah.
Mhm.
That's absolutely right. It is very difficult. And so, like, I think about, obviously one of our aims here at ASAP is to intervene. You mentioned this a moment ago, and just to double back to this,
Mhm.
you never know what kid is going to develop a
Right.
lifelong problem versus the kids that will not. There are a lot of red flags, though. There's a lot of predictors, correlates that we are looking for. Like when we have a kid that comes in for an assessment with us and we're doing an intake, we're looking for those kind of red flags, the correlative kind of, indicators that would suggest that a kid may be on a pathway to a more serious problem. But it's absolutely our approach to intervene with them as early as possible,
Mhm.
to try to get the issues under control right away. Again, because the earlier you stop it, the less they go down the path, the less the problems, um, the less severe those problems are likely to be in adulthood. It's not a guarantee they're not going to happen, but it certainly gives them the best chance for their prefrontal cortex and the rest of their brain to develop up to adulthood by not using mind-altering substances during that corridor between 13 and really 22 or 25. I mean, the most recent data says 25, but it's
Mhm.
once you get kids in college, like then it really is tough. So we are so focused on 12 to 19, like this is our sweet spot of
Mhm.
we need to help your family eliminate this risk so that we can get your teenager across this kind of gauntlet and to the launch point where they can go to college or they can go to
Mhm.
trade school or whatever's after high school successfully and with the
Right.
best chance to really achieve you long term. And that's kind of our
Right.
approach.
So if you were sitting down with parents that have now found that their child is, using, it could be nicotine, but probably the
Yeah,
THC. What are some of the red flags and things that you would share with parents so that they know, whoa, this is a little more serious than what I thought?
absolutely. Absolutely. This is tricky because honestly, some parents, parents really range. Some parents are very restrictive and they have a lot of parents, like they have experience in their own families. Most people know somebody, whether it's in their own
Mhm.
family or somebody that's close to them, who struggles with an addictive disorder. Most adults, at least. Um, and what that looks like is different for different people. So some parents come in and they're really concerned. Some parents come in and they're like, oh, he got caught at school with a cart, and and I don't really know, he said it was his friends, and so I don't really think there's a problem there, I don't think there's any issue. That's a huge red flag, right? A kid that's bringing mind altering substances into the school setting and using them in school, whether they say it's their friends or not. I was holding it for a friend is the oldest excuse that is almost always a lie.
Oh,
um, yeah. That's one that's a huge red flag. Using by oneself is a big red flag.
okay.
Um, using on weeknights or on days where they have school, using before or after school. These are some other red flags for substance use issues. Periods of time that are blackouts where, where you can't remember exactly what happened. You mentioned greenouts where you have medical complications, where you're throwing up or where you're getting sick or you're doing things that are not consistent with your values while you're under the influence. Those are pretty big red flags. Lying to your parents, changes of friends, dropping activities that you previously enjoyed. Kids on the basketball team, all of a sudden things kind of shift and change. All of a sudden there's a change in personality. You're not sure what's going on. They're no longer hanging out with the same crew. They've got some other friends that maybe the parents don't know. They're disappearing. Money is disappearing. They're sneaking out at night. These are some of those kind of correlative things that we're looking at that are suggestive. And also for most kids that'll come for an assessment with a facility like ours, we're going to do urine drug screening so that, it's a trust but verify system, right? I'm going to believe what you tell me. And also I'd like you to screen for us because I want to make sure that we're getting the true story. Because if we're not, we want to help kids to be honest. We want to help them open up a pathway for honesty within their family system. And, recovery starts with honesty. It starts with openness. It starts with willingness. And that's really the foundation that we want to set here with ASAP and our programming to try to help these families recover.
So what does a intake and, how, let's go with somebody that has been identified by the school. And I know that does happen.
Sure.
And then, they talk to the parents. Then do the parents call ASAP? How does that all work?
So it can work a couple of different ways, but generally that's usually what happens. Generally, the pathway through schools usually would be a kid gets in trouble. They come to a dance intoxicated. They're found to have, the dogs come to the school, run through the school, and they find that, the teenager has a cart or some substance on them during school. So they'll get suspended usually. Oftentimes it'll be like a 10-day suspension with a recommendation for expulsion pending an assessment with a qualified, facility or professional. And that's kind of where we take over. That's, we'll get a parent that'll call us and say, hey, Johnny needs, he needs a substance use assessment before he can return to school. And we have this meeting with the superintendent, on X date. So they'll come to us. Our intake process involves a meeting with, obviously, the teenager themselves. We'll spend about an hour with the teen themselves to kind of gather a history. We ask all kinds of questions. Some of it's related to their drug history and how much they use, getting a quantity, what we call a quantity and frequency. How much are you using? How frequently are you using? What substances are you using? What have you tried? Do you feel like you can quit? Is this an issue for you? Questions like that. But we also will collect broadly a lot of information about family history, a lot of information about mental health functioning, school functioning, history of legal consequences, stuff like that. We'll get as much information from the kids as possible, usually about an hour with them. Separately, we'll meet with the parents. And this is something that's unique about our program is we are a family-based program. So we strongly believe that without intervention at the family level, that the likelihood that kids are really going to get the most out of a program trying to help them establish recovery is pretty low for a lot of the reasons we've talked about already. Mm-hmm. But we leave the kid with some psychological measures they can fill out so that they're occupied. And then we'll go spend about an hour with the parents. And we require at least one parent to attend, but it's definitely better when as many family members as are actively participating in the teen's life can attend the intake. Mm-hmm. We'll spend about an hour collecting some information, similar information, oftentimes things that the teenager doesn't know, things like early childhood developmental issues, other family history questions that they just, kids tend not to know, did grandma have a drinking problem or not? Things like that. And, what was the mental health history on dad's side of the family? Because those are sometimes taboo things that people just don't talk about. So we'll get that information from parents. After we do that, we'll score the measures that we take from the kids, and then, we'll make a recommendation. And while we do have a substance use disorder program that is one of our 2 flagship programs, we also have a mental health primary program. So there's plenty of kids that even if they come in the front door and we expect, okay, this is primarily a substance use problem, sometimes we find out, we actually think that this is primarily a mental health issue, and they're using the substances to treat an underlying depression or anxiety or obsessive compulsive disorder or something else that actually we want to address that first and try to help the teen establish recovery by working primarily on their mental health symptoms. So then what we'll do from there is make a recommendation. Sometimes the recommendations we make, they range all the way from, this kid was just caught in the wrong place at the wrong time and truly doesn't really need any intervention. And those recommendations range anywhere from there kind of through kind of an intermediary place where it's, some education about the substances or about issues that they're having or individual therapy. We offer 2 flagship programs that are the primary most of our referrals are coming to us for those intensive outpatient programs that we run, because they're kind of unique in the way they work. But we also do get some referrals where an intensive outpatient level is honestly not enough to address the severity of the issue that the kid is coming in with. So we do referrals out to other partial hospitalization programs or residential programs or acute inpatient stays. But to be honest, we really prefer to keep kids in their home, because the truth is that going away for treatment or being hospitalized is, there's not a lot of data that supports those as the most effective interventions. The best thing we can do is keep kids in their home environment, help them work through the issues they're having there. And that's what our intensive outpatient programs allow those kids to do. And so we'll make a recommendation, and then, it's the parents, decision about what they think is best for the family. Sometimes there's some pressure from the school or from courts or other places to actually follow through with our recommendations. But it's ultimately the family's call and whether or not they think we're going to be a good fit for them. And some families are, and some families elect not to do treatment. And that's kind of our process.
Yeah. Okay. Well, when you have someone comes or they call you or whatever, and I'm fairly familiar with marijuana, and actually done some training and stuff with it, but about it from out in Colorado. But I know that what they're seeing now in lots of places is that the child becomes not only delusional, but paranoid, thinking someone's after them, and, all that kind of stuff. And then, of course, the connection to schizophrenia, and you can certainly talk about that. Would those be instances then where you would have to send them to, like, I'm just guessing, like Linder Center or somewhere else where they would be an inpatient kind of thing where they could really watch what's going on with them?
Yeah, there are situations where that is needed on a short-term basis. And I think you're bringing up a really important one, is if, especially if a kid is displaying any kind of what we call psychotic symptoms, hearing voices, seeing visions, having kind of intrusive ideas in their head that they have to go hurt themselves or somebody else. The biggest reason that we use our community partners, you mentioned Linder, but also Children's Hospital, of course, is for when, situations where kids become, they're having thoughts about wanting to end their own life, and they really need 24-hour supervision as they kind of ride the wave of their suicidality or their homicidality, or their agitation is just so great that it really needs to be monitored in a hospital setting. So those are definitely situations where we absolutely lean on our community partners. And you are right. There is a lot of data that talks about how adolescent use of cannabis does increase the likelihood of people developing those kind of psychotic symptoms. And so that's just one of the many reasons that we are advocating for teens to be abstinent from those substances during these years, because, sometimes kids will stop using and those symptoms will go away on their own. Sometimes they need to be medicated. And sometimes those medications, the medications for those kind of disorders, they are lifelong medications, and there are negative impacts from them. And so, of course, any parent's goal is to, I always joke with parents here. I say, when you hold your little baby, at the hospital, you first of all, you don't get a manual, right? It's tough. No. It's tough raising them.
It's tough.
There's no playbook. So as much as we'd love there to be one, there's not. Nobody imagines themselves in rehab with their kid. No. And the truth is that it's really your responsibility or your job to try to get that kid to 18 years old as safely and as put together as humanly possible. Are they going to fall down and bruise themselves? 1,000%. Are they going to have struggles? Yes. Are you going to do the wrong thing and say the wrong thing 100 times over? And that's going to happen, right?
Yeah, right.
At the end of the day, the goal is to get them to 18 put together so they can make something of their lives, and try to instill some values there and help them become the best version of themselves. And kids who hit this pathway, they fall off that course more than other kids. And so we're just all about getting families back on the right track. We're all about helping to nudge families, help parents, reset their norms, figure out what the direction needs to look like for their kids and for their family, and then support their kids through that, because these issues just it's like they take the house, turn it upside down, shake it up, and then the parents are just like, oh my gosh, what do we do? We can help with that.
Like you said earlier, it affects the whole family. So, let's say this is, the oldest child, usually not probably, but, one of the older children, and you've got little ones or younger ones or whatever. I mean, they're feeling that. They're feeling the tension and the stress and all of the parts that go with that. And then you never know how that's affecting them, down the road. I always say, and you can change this, it might not be right, but I read that it's about an 83% crossover. It could be less or more, I don't know. But for, the mental health and the substance use, and you tapped on that when you said that, it's almost like what came first, the chicken or the egg,
Right, it is.
Were they anxious and they self-medicated, or
right.
were they just kids being kids and they started experimenting with it?
Right.
And that has ended up in not only things we've been talking about with the marijuana and stuff, but, ends up in them taking their own lives. And, there couldn't be a worse outcome than that.
Right.
And
absolutely.
Yeah, we had a lot of that. Strangely, out here in Anderson, we had probably 5 or 6 that were in probably less than a 5-year period. Now, drugs and, substance abuse wasn't talked about in all of it, but it was talked about in some of it.
Sure.
And, there's so much that parents don't understand and the kids don't understand. And I had a parent call me, and I don't give advice because that's not my role.
Yeah.
But, you can listen, of course, and direct, where they can take them or whatever. But, this dad said, oh, my husband is using my child is using THC, but he says it kind of chills him out and whatever. And, and I said, that's interesting that you say that, because that might be the first indication or first thing that they notice. But it is actually connected with much higher levels of stress. And, and I'd give them an article to read, or send them to you and, that type of thing. But parents don't understand that, and they think that every kid, because the surveys come back this way, that every kid is stressed out. And I'm probably thinking with the social media on their phones, they probably are. But, that's a big piece of all of this,
it sure
unfortunately.
Is.
So, how do you address that? When you're trying to get them to turn things around?
100%. Yeah. So there's a ton of data on what you were saying, particularly like with adolescent girls and body image and exposure to social media, drug attitudes. I was talking a little bit when we first started, talking about how things have just shifted and changed over the last 15 years since I started doing this. And the biggest change of all is, we've basically turned an entire generation of kids into guinea pigs with social media, and no regulation whatsoever from a top down perspective in terms of the impact that it has on functioning. And in fact, there's a lot of incentive from the technology companies to maintain the status quo because they make money off of kids watching these ads. And so they have been far too slow to react to known problems that exist within these platforms, and they're ever changing. So it's, Snapchat, the soup du jour is TikTok, of course, but it's been Snapchat, it's been Vine, it's been Twitter, it's been, all of these different services.
Well, and we've moved, what you said about the years and where you saw the big changes, were years that we started more and more of the phones, connected to the internet.
That's right.
And back and forth. So there's a real correlation between those two things, I would think.
Absolutely. Well, and also the tricky part about this really is, especially the kids that are in, high school now, that are kind of in the corridor of the kids that we treat, is that so many of them went through the pandemic where we were all isolated, and, they're only, for almost 2 years, their main source of being able to connect with anybody, right, and have social connection was through social media and through their phones and through video games and, all of these different medias. And at that time, that was a lifeline. It was a godsend because at least we could connect with each other as we were trying to ride out the pandemic.
Right.
And one of the kind of challenges with that is that they became very highly reliant on social media as their conduit for communicating with one another. And there are risks with that. They don't know how to socialize the same way as kids that I sometimes talk about it as an analog upbringing, like someone I'm 42, but someone like me, I grew up analog. We didn't have the internet until I was in, high school. And then even then there was no social media. It wasn't the way it is now with bullying online and all of these social pressures that they have. So they didn't have that. They didn't have that advantage. And so they've grown up in this new world of technology, and it has definitely impacted them, and it definitely impacts their functioning, their brains. Certainly there's an impact on their mental health in terms of, social media consumption and just having an online life the way that they do.
Yeah.
And
well, with underage, getting back, I know we've been talking a lot about marijuana, but
yeah,
with underage drinking, and all the new drinks that are out with, flavors this and, when they still have alcohol in them, and parents not really knowing how much the kids are drinking. It seems like, the old delay is
Yep.
really, it's like I did a thing with Mothers Against Drunk Driving and
yeah,
impaired driving, and that's what what she was saying too is
yep,
that you just it's not like you think that your child is never going to have a beer or a drink or
of
whatever,
course not.
but and they're not a prohibition agency by any chance. They just want to keep you safe off the roads and
That's right.
boating and everything else. But
Sure.
with kids moving into drinking and whatever, if they start when they're, just like you said, with the brain development, like 12 or 13,
Right.
they're going to have a much higher incidence of
Yep.
adult addiction to
Yeah.
alcohol. And, it's so funny because even though, with this recreational marijuana now and everything we've just talked about, and then of course, mentioned this, kids have a tendency and almost a part of their whole personality to experiment a little bit,
Right.
So, I mean, kids are going to try this, and those are the stories that they tell at Thanksgiving and their parents fall over dead. But you know what I mean? I had no idea, whatever.
Right.
But I think the fact that if we can impress on parents that all of this needs to be delayed
Yeah.
till their brains are a little more developed
Yep.
is going to make all the difference in the world.
Yep. The data bears that out. Kids start before 14 are 6.5 times more likely to develop addictive disorders in adulthood than kids that wait.
Mm-hmm.
And that's why the drinking age is 21. It's not, it's always been a kind of a sticking point for people of saying, well, you can go and join the military and die for your country and not be able to have a drink. But the reason is that number came from data that basically if people didn't drink until they were 21, the likelihood they would develop alcohol use disorders was extraordinarily low.
Right.
And so that's exactly the approach that we work from here. Even when kids have already started, parents will say, well, like, it feels like it feels like so much effort to just, really kind of be on top of them and trying to promote this abstinence approach. And I always say, like, this is a day by day fight, that the less that you can have them consume on a daily basis gives their brain the best chance to come up to that level of maturity that's ultimately going to help them say, this isn't for me. The truth is that, drinking peaks for most people the fall of their freshman year of college, right?
Mm-hmm.
And substance use, I think, to a large degree in the same way. Most people go to college, they go crazy for a couple of weeks, and they realize, holy cannoli, there's a lot of consequences if I go crazy like this.
Mm-hmm.
And then there's a precipitous drop off in terms of the amount and the frequency that people drink. And it's just simple learning. They realize, I'm going to either fail out of college
Mm-hmm.
or I'm going to fail out of this job or whatever I'm doing if I don't get my stuff together.
Right.
And so by the time they turn 21, they're drinking way less than they were at 18 or 19.
Absolutely.
And the truth is that they're just learning through consequence. Most people are going to learn that naturally. They're not going to need intervention from a place like us. But for those kids that are starting early, for those kids that have those red flags, I always tell parents, I would rather overtreat a kid that's on the fence than undertreat a kid that ultimately develops a lifelong problem with substances.
Absolutely. Because it affects so many people down the road. You have an
Right.
adult that, he has an alcohol abuse disorder, whatever. I never say the
Mhm.
right words. But, you have them and, they end up usually, affecting their children. Then the
Right.
children end up in trouble or they end up in a bad marriage. I
Sure.
mean, this is it's a cascading kind of
Yep.
thing. So
Right.
getting it early, and we're heading into spring.
Yeah.
So I think
Yeah.
today's weather doesn't feel like it, but
No.
heading into spring. And so we've got spring break. We've
Yes.
got, prom for the
Prom.
older
Right.
kids. We have graduation
Hmm.
accompanied by a million parties. And
Yep.
then we have the kids that are going to go away to college with all their going away to college parties, and alcohol is a very big part, unfortunately, of that.
Yeah.
And then of course, you have extra things like the THC mixed with
Right.
that because their inhibitions are lowered.
Yeah.
It's kind of a setup for catastrophe. And
Yeah.
that's why we want to do these podcasts to try to educate the
Sure.
parents so that they, I'm not going to talk to their children. I mean, you can, of course, that would be great. But you know what I'm
Right.
saying? It's got to be, they have to take personal responsibility and talk to them as well. And there's so much out there of how to do that if you're
Sure.
not comfortable with it.
Yeah.
Yeah.
It tends to be taboo, and a lot of parents want to be the cool parent that their kids
Yep.
like, and it's hard to set limits with your kids. You love them and you want what's best for them, and sometimes wanting what's best for them is at odds with what they want.
Right.
And so, a big part of what we do is helping to. You mentioned this before, and I think it's a really important point. Parents often feel like they have very little influence over their kids and what they do. That could not be more wrong.
I know.
Their kids are watching them. Their kids are observing them. They model appropriate behavior and inappropriate behavior sometimes for their kids. And if they set a tone in their house about their expectations around alcohol use, drug use, school performance, it doesn't just have to be drugs and alcohol. Spending time on the internet or playing video games 9 hours a day. I mean, there's all kinds of ways in which kids can fall into problem behaviors. Setting those expectations with them clearly and staying on top of them and really just being deliberate with it, that'll go further than a lot of people realize. And unfortunately, people don't really set those limits because I think they're fearful of, upsetting their kid or of coming off too strict or not being likable or, being unfair. But the truth is you are, to some degree, I mean, not to be overly dramatic about it, but to some degree you are in a fight for your kid's attention. And
for their life.
And for their life. And
life.
if you don't go to some lengths to try to create an environment for them where they can flourish, they'll find it somewhere else. And when they go to their friend's house, I think one of the other kind of sequelae or consequences of phones and social, parents don't know their kids' friends.
No.
Like they don't even know who these kids are.
Right.
Years ago you had to call. Remember back in the day you had to call
in the kitchen on the phone.
Exactly. Yeah, I'm sorry, Mr. Smith. Can I speak to Jimmy? It was so they knew, knew who your parents knew who your friends were, and you had to come over to come talk to them. Now, kids have these elaborate social circles. The parents have no idea what that social. So they could be going over to this friend's house. They could be getting drugs, alcohol. You have no idea. So as a community, like there is a piece of this that is, pulling together to say like, hey, I want to know who your friends' parents are. I want to know that when you're going over to this person's house, that this is a drug-free zone, that, that they're keeping an eye on you guys, that they're not letting you go out at 2:00 to go to Waffle House and whatever shenanigans you're getting into. And this is, that they are keeping at least an eye on you guys. And it's tough. If I had a nickel for every parent that said, well, I'd rather them be drinking in my house, then it's like,
oh gosh, yeah,
which is, and
that is not good.
It's a real, there's a lot of parents that do think that way, and I certainly I understand where they're coming from, and at the same time also recognize that is parental modeling that tells your kid it's completely fine to get totally wasted and get drunk and do whatever the impulsive, crazy stuff you're going to do.
Exactly.
And that is not.
I heard something the other day that really caught my attention. It said, what you allow, you promote.
Yeah.
And I think there's a lot of truth to that. I have a relative that the parents were very easy peasy about them drinking at home, at parties and whatever, family things. And, and one of the kids is now full blown alcoholic. I mean, has affected everything. So I know this happens. And all I can do is I keep, we do a lot of social media stuff too. And besides the podcast, and I just keep sending out these myths, what the truth is, that's not true. But it's a hard sell, and people would just rather be lackadaisical and, oh, everything's fine. And, whatever, until it's not. And then by that time it's so far gone. They're lucky if they get to you. You know what I mean? It's like,
that's the worrisome part. Yeah. That's some of the saddest things that we deal with are those situations. I would say though, I think this is an important point, is that it's never too late to change course. It is never too late to course correct. Even for parents whose kids are out of the house, it is not too late to course correct. You can make decisions to not have alcohol at your holiday festivities to support your family members who are trying to be in recovery or who have their own challenges with alcohol. It is never too late to course correct. And, and it can be hard, it can be difficult, and also it can be done. It really can.
And would you say to parents out there who know their child is in trouble and have begun the process or haven't yet, that there is hope, that there's
100%.
That's what I think. They think, oh, they're too far gone. I tough love and I'm out of here and whatever. But I just want them to
100%.
know that there is hope and that there is course correction, like you said. And that's what your job is. That's what ASAP does. And that's why when I was looking through some notes that I had, that's how I got you, because I was looking at ASAP and I thought, and I have had some interaction. And I thought, we need to get you on here, get someone on here from ASAP to talk about this stuff, and that there is hope out there. And it's not all over, you can turn it around.
Yeah. Well, first of all, I really appreciate you having me. I think I should have said that earlier, but it's really great to be here and get to talk about this kind of stuff, because it is taboo and a lot of people don't want to talk about it.
No.
But the truth is that the earlier you get someone into recovery, the earlier they start experiencing the benefits of being in recovery. And I mean, there are just dozens of like heartwarming stories that I could tell you of families that were just, at the end of their rope, trying to figure out how to help their teen, feeling like there was no hope, feeling like things were just spiraling completely out of control, and again, I'd love to take credit for all of it. I sometimes think of us as, planting the seeds. We plant the seeds, we water the seeds, but it's the family that does the work. It's the family that makes the change. It's the kid that comes in here with the openness, and most kids come in here, they don't want no part of it. So totally, that's the expectation. Most of the time when they come here and we work with them and we start to really peel the onion on why they're here, whether it's for mental health problems or whether it's for substance use problems, we start to help them to see how this is really impacting them and their lives and their family and their siblings and their grades and their ability to play sports and their physical health. And they start to see like, okay, I might not want to quit, but I also know that this is probably what's best for me. And then sometimes you just see the miracle happen. It's absolutely amazing. You see kids that just flourish. And we have a handful of kids who have been failing out of high school, who have gone on to medical school. And we have one kid that became an addictionologist who came through this program and became so passionate about recovery that he just wanted to treat other people who struggled with the same issues he had and has been sober for 10 plus years. And it happened during his adolescence. Like, he was able to turn it around during this period of time. It didn't take him going down the road and having to hit rock bottom after rock bottom. He was able to pull himself through this at this time with the support of his family and his friends and his therapists and the services that we provide here. But there's many success stories, and and it starts with a phone call. It just starts with reaching out. It's a hard thing to do. It's the heaviest phone that anybody will ever pick up is calling us and asking us for help for their teenager. It is a brutally difficult thing to do, but we know this process. We know how to help. We know how to be there for these families, and that's our passion. That's who we serve. We only really treat teenagers, although we're talking about opening a young adult program for a lot of the reasons we talked about. I think this summer we're going to be opening a 19 to 26 program for kids that are kind of in that failure to launch, not really ready for an adult program with people on opioids and stuff like that, but they still are having some of those same kind of issues that, trying to get themselves going in the right direction.
Well, maybe what we'll do, we're coming up on a hard stop now, but maybe I'll have you back and we'll talk about
love it.
That.
That'd be great. That would be
maybe
awesome.
You could share some of these success stories with our audience because they need to hear that. Some people really are on the fence about what to do. And I think that might be a really good thing, but I can't thank you enough for being on today. I really can't. I think this has been great. I can't wait for this to get launched and for parents to start listening to it and that type of thing. And I'm grateful, very grateful. So
thanks for having me. Be happy to come back anytime and talk about it.
Okay. Well, you have a great weekend and thank you so much.
You too. Take care.
You too. Thanks. Thank you so much, David, for being on our call today. We've learned a lot and we've taken away some hope. And that's the biggest thing that we could take, I think. And to our audience, thank you for listening. You can see these podcasts on our YouTube channel, which is Step Up to Save Our Children. And we are also on Facebook, Instagram, X, LinkedIn. You can find us lots of places. And if you're looking for this, you can also go to our website, which is www.stepupanderson.org. And all the podcasts are on there. And we'd like very much for you to like our channel and to subscribe because that helps us a lot. We need to get the word out so that we can reach more and more parents. So thank you all.